Okay, so welcome to the fifth in our webinar series for AHP careers. This webinar will take you through the role of the therapeutic radiographer, and we have 4 therapeutic radiographers talking about their roles, and this will be followed by some information about entry requirements and routes into the profession from Zoe at University of Essex. I'd be grateful if you could keep your cameras off and microphones off during the webinar, and there will be opportunities for questions at the end. So please do write them in the chat. If you haven't been to one of our webinars before or listened to our webinars before, the allied health professionals, or AHPs, are the third largest workforce in health and care. And in the main, we're degree level professions and are professionally autonomous practitioners. There are 14 registrable titles for AHPs covering 15 specific roles. And you'll notice on the slide that there are 16 professions, and that's because in the UK, prosthetists and orthotists are dual registered as one profession. And there may be some professions that you've never heard of. And if you're interested in a career in health and care and you don't know what yet, I'd encourage you to have a look at some of the AHP roles. AHPs provide system-wide access to care, and they assess, treat, diagnose and discharge patients across health, social care, housing, education and the independently voluntary sectors. Through adopting a holistic approach to healthcare, AHPs can help manage patients' care throughout the life course, from birth right through to death. Their focus is on prevention and improvement of health and well-being to maximise the potential for individuals to live full and active lives within their family circles, social networks, education training and in the workplace. And today, within this webinar series, you'll hear about 7 AHP careers, and today is the role of the therapeutic radiographer. And with that, oh no. So you can find out a little bit more about the other webinars within the series. They are all on YouTube. So you should be able to see those on YouTube. And we've got 2 still to come, the role of the diagnostic radiographer and speech and language therapist. And with that, I'm going to hand over to Anne to talk about the role of the therapeutic radiographer.
Thank you, Nick. Yes, role of the therapeutic radiographer. Many people have heard of radiographer but don't actually realise that there are 2 branches. Basically, what we do is use high energy X-rays to target cancer treatment. Have the next slide, please, Nick. So if anybody out there has heard about the Race for Life and Cancer Research UK, think about them, think about us. It's very much linked to our profession. A lot of those people are running in memory of people that have been treated or suffering from cancer. And we are the only profession that is qualified to deliver cancer treatment. So it's a highly targeted therapy whereby we use high energy X-rays to treat disease. And radiotherapy works by destroying cancer cells, specifically in the area that we're treating. So it's not like other treatments that work throughout the whole body. It is a very highly targeted, specific treatment. And as you can see on the screen, we use some very high-tech machines. And on the last image, you can see a patient in a shell with some lasers guiding where our treatment's going to go. So it's very, very highly targeted. We can use the treatment to either cure patients or relieve symptoms. And although it is a targeted therapy, we are often used alongside other systemic treatments or other methods of treating cancer. So as I've said, it works by destroying cancer cells in the targeted area of the body. Patients might have 1 treatment, patients might have up to sort of 6.5, 7 weeks of treatment. So we actually get to know our patients really, really well. As I've said, we get to know them, we support them through their treatment, before treatment, after treatment. So there's quite a lot to our role. Can I please have the next slide, Nick? Okay, so we care for our cancer patients. Our role blends, as you can see, technical expertise with supporting those patients and also their relatives and carers, because often they come into department and they're not always on their own. They bring family, friends, carers with them, and often they need support as well. We work very much as part of a team. Within the treatment room, we work in pairs and often with our students. And we also work alongside other professions, oncology doctors, dietitians, speech and language. So we are part of a very wide team. And that said, once you qualify within our profession, there are quite a range of career opportunities. Can specialise in different areas, such as pre-treatment or planning that my colleague Izzy is going to talk about. You can become a treatment radiographer in its own right, which Michelle is going to talk about. You can go into consultant radiographer roles, review radiographer roles, into research, patient support, and like myself, towards education. So there's quite a wide repertoire of things we can go into. So next slide, please, Nick. So what do we need from our students, and what sort of people are we? Well, we're dealing with people who are going through quite a difficult stage in their life. So we need to be kind and compassionate. We work in teams, so we need to like to be a team player, and we talk to quite a wide variety of people. So effective communication skills are always a bonus, and naturally being friendly and welcoming, putting patients at ease is quite an important aspect. As you get to hear, problem solving is quite a large part of our role, and we are dealing with people. So high level of accuracy and dexterity. We are moving patients in very, very small movements to make sure they're in very accurate positions. And the ability to maybe think on your feet to solve little problems that might come up as we go through the day. We all like cake and chocolate. We get to know our patients, and very kindly, they often leave things behind for us, and that helps us get through the day, which is lovely. So, in a nutshell, that's who we are and what we do. We are a very specialised profession. As I've said, we're the only profession that can do what we do, and a profession very much in our own right. So if you do happen to see the advert on TV for Race for Life or anything like that, Cancer Care UK, such like, please do think of us if you're thinking of careers to look at. Next slide, please, Nick. And I think this is where I hand over to Izzy.
Hi, I'm Izzy. I'm a qualified therapeutic radiographer, so I've been qualified for about 3 years now. So I'm going to talk a bit about what happens when the patients first come to us. So they have a little meeting with the doctor, and they go through the risks and benefits of the treatment. Once the patient's happy with all this information, they come through to the pre-treatment team. So that involves a CT scan. So what we do is we get a big team together to discuss the different types of immobilization we may use for the patient, and depending on where they're being treated, they may also have an MRI scan as well. So it's about having a look at the different types of imaging we can use as well. Can I have the next slide, please? So this is sort of a little example of how we can position our patients. So radiotherapy is all about accuracy, not so much about comfort, unfortunately, for the patient, but we like to be very, very precise with millimeter accuracy. So that's why we have to be very specific about what we can use. So in the top left, you can see sort of some immobilization we'd use for positioning pelvis treatment. So it supports the knees and the ankles. Underneath that one, got a breastboard, so patient would be laying on that with their arms above their head. So this keeps them nice and still. This is all adjustable to each patient, so there's always a wide range of settings we can use, but again, it's all about the accuracy. The two in the middle, so the one at the top used for sort of skin treatments, so very close. So we've got to make sure we're careful with these ones because we don't want to treat anything that would that we don't want to treat, such as, you know, you can see it's covering the eye there. Again, underneath that one, we've got a mask we've made, so that keeps the head very nice and still. As you can imagine, it's really important when treating head and neck that we're very, very careful with, but we don't want people to move, basically. We also do little tattoo dots, so this isn't where the treatment's going as such, it's just used as sort of a reference mark, and we do these in our CT scan as sort of a reference point, so we know where to set the patient up to each day. The next slide, please. So once the patient's had their planning scan, this then goes to our planning team. So what we do there is we have a look at the scan, we outline the different parts of the body. So these are called organs at risk. So such as your bladder, your femoral heads, or your heart, things like that, things you don't want to treat, your spinal cord. So it's just as important to get the areas we don't want to treat out of the way as what we do want to treat. So it's really important that these are outlined, and going forward as well, there's a lot, we use AI in our work now as well, so that's quite good. That helps us with our job. So if you're quite technical minded, it's a really important part of the planning process. So these plans can take a few times of going through our systems to get them exactly right and get the dose exactly to where we need it, while sparing what we don't want to treat as well. We can treat with our linear accelerators moving all the way around a patient. Sometimes they're at one angle, so there's a lot of different ways to get the result you'd like to get, and then that goes to the doctor and they look at the plan as well. So there's always a really big team around the planning of the treatment. So if you like, you know, if you're a team player, good job for you. I think next slide, please.
And this is where I get to say I'm a therapeutic radiographer. I do it day in, day out. Part of the role is to make sure that the kit is safe and accurate. So we check that the machine works, and then we start treating patients. And that's the bit I like best, because I'm dealing with real people, and we are curing them or we're easing them from their symptoms. So I love the fact that we can really help them whilst involving science, technical kit, teamwork. There's a whole host of things that you just don't really get unless you come and visit us and have a look. You may find that you might have a family who've been for radiotherapy, and it is cool. It's like walking into a Star Trek set that costs £3 million, and we're using this to treat people, make them better, or to ease their symptoms. There's a lot to be said about radiotherapy, in addition to which we have lots of chocolate and I have lots of cups of tea. Next screen, please. Now, these clips are about your typical day. We work in a team. We have 2 people in, 2 people out treating, one of whom's a radiographer, one's a senior radiographer. And we always work in a team. So if I've worked in the room like I have this morning, I'll work outside the room this afternoon doing treatment preparation, organising, it might be organising prescriptions, doing data prep, reviewing daily images. So not only is this science and caring and cool bits of kit and chocolate and cups of tea, it's also biology. We're getting to see anatomy, which is another really interesting thing that you can see in a 3-dimensional and 4-dimensional way. So if this is something that you're interested in, have a chat to your careers advisors. Come have a visit. That's what I would say. Oh, my favourite time, I have to admit, I'm sorry about this. It is home time at 5 o'clock. Next screen, please. As part of our role, we refer patients to Macmillan team, to the dietitian team. All of this is about supporting our patients. I think, what would I want for my parents if they were coming here? What would I want for my friends and family? And we've got an amazing information centre where people can get extra support, get blue badges, do complementary therapy, or just sit and have a chat. So as well as having the technical aspect of our role, there's the caring side. Over to you.
Thank you, Anne and Izzy and Michelle. It's great. It's really nice to hear about your bits of the role. I'm going to hand over to Zoe, who's from the University of Suffolk, to talk about the degree course there.
Thanks, Nick. Okay, so as Nick said at the beginning, we're often, so therapeutic radiographers do have to complete a degree qualification. So it's a 3-year course. Typically, so here at the University of Suffolk, it's called Radiotherapy and Oncology, and at other universities, you may see it called Therapeutic Radiography. So there's just some slight variance when you apply for the course. Can I have the next slide, please, Nick? Thank you. So for us here at the University of Suffolk, we work with 4 radiotherapy departments. Our students have over 50% of their course time actually in placement, because it's really important you learn to do the job. There's lots to learn whilst you're actually in placement. So we work with Ipswich, Colchester, Addenbrooke's Hospital in Cambridge and the Norfolk and Norwich University hospitals. And each hospital has a practice educator to support you whilst you're in placement, as well as a mentor. So Anne, who spoke earlier, is our practice educator at Ipswich Hospital, and would very much welcome any visitors who were interested in doing the course. But like I say, placement is really important, and having that support in placement and learning with the radiographers is invaluable for you, because these are the people that are doing the job every day. And as Michelle and Izzy have explained, a lot of the role is that technical aspect, but also the anatomy and how we care for people. So we teach some of that here. You learn the physics of how all that cool kit works, but then we also teach you the anatomy, so that when you go out to placement, you can actually understand what you're seeing. All those grey blobs on a CT scan, what do they look like? So we teach you all of that too, but also how you care for people. We give you skills that you can then apply in practice. Okay, next slide, please, Nick. So how can you apply for us? Obviously through UCAS, and you do need 112 UCAS tariff points or equivalent. So that's BBC at A level or distinction merit at BTEC. We also accept T levels, access to the HE diploma, and all sorts of other combinations. And our admissions team here at the University of Suffolk can give you further guidance of what is accepted. But basically anything that attributes to 112 tariff points, or you might have a degree in something else already and looking for a career change as well, for other people who aren't in schools listening to this webinar. You also need GCSEs in English language and maths, and preferably science too. When you complete your UCAS application, you do have to complete a personal statement, and this academic year, UCAS have changed that to 3 directed questions, so you can actually make your personal statement more focused on what we need to know at a university level. Show some academic interest in what you're going to study, in what you're writing, but also we want to know about you and what you can do and what you can bring to the course and the profession. So is it that you've got some work experience? Don't dismiss that time that you've been serving teas and coffees in the local coffee shop for the past 2 years, or that time when you've volunteered at Brownies or Guides or Scouts or whatever else it is you do. All of those skills are really, really transferable. You talk to lots of different people in those roles. You work as part of a team, and those are key things we need in our therapeutic radiography workforce. You'll also be required to have a reference from school, college or an employer. And then once you have been through that application process, we'll review your application here at the University of Suffolk and invite you for an interview. And you'll then complete an interview with us. And if you're then offered a place, you'll have to complete an occupational health check and a DBS check, just to make sure that you are well enough, but also are there things we might need to put into place to support you to be your best self whilst you're learning with us, but also to check that you're safe to work with other people too. Okay, so you can apply, that slide's incorrect, obviously you can apply for September 2026, not 2025, and we will happily welcome any applications and questions from you. Thanks, Nick.
Thank you, Zoe. We've just got a couple more slides, so I know that we've just had a couple of people join us. Welcome. We're just right at the end of our webinar, but it will be recorded and be ready and played on YouTube. But these are a couple of a few resources where you can go and find out a little bit more about the role. Just there's a really great podcast called Rad Chat, which is run by Connor. I think Connor and somebody else from that talks about the role of the therapeutic radiographer and all things around therapeutic radiographers. So it'll be really, if you're really interested in being doing that, then please have a look for that. There was also a brilliant documentary that is still available on Channel 4 on demand by a comedian called Rod Gilbert, who had head and neck cancer, and there were it kind of details and documents his journey through radiotherapy in the main, and there were some brilliant radiographers that he said during his journey that, you know, kept him going when he was in the real dark bits of his cancer treatment and towards the end of his radiotherapy. And so if you are interested in exploring a little bit more about the impact of radiotherapy for people, it would be great to have a look at that documentary. It was brilliant. I think it's called Rod Gilbert, A Pain in the Neck. And with that, I'm just going to invite any questions. I know that you've just come onto the call, so you may not hear the questions. You might not have any questions, but please do watch the webinar back. If people are interested in finding out a little bit more too, you can, through ESNEFT, contact the Talent for Care team through the work experience at esneft.nhsuk.uk, and then you can come and arrange a visit to come and spend some time with the team on either of the Ipswich or the Colchester sites. So please do that if we've got people that are interested or in other AHP careers. With that, I'm going to stop. Thank you very much for coming, and have a great afternoon.